people that may be, friends or family members of someone who has an addiction to opioids. What they recommend is, of course, purchasing the naloxone kits ahead of time if you suspect that, just to have that available. Now, if in the case of suspected opioid-induced cardiac arrest, it's important that when you walk in, you see this person most likely lying on the floor, you put them on their back. You also scope out the area. Do they have any needles or syringes? Are there any empty prescription bottles around? One thing that opioids do is they actually cause the pupils to constrict. And they cause pinpoint pupils. And so you may be able to check that individual for that occurrence, which would indicate some opioid use as well. Is there kind of a bluish tinge or cyanosis around the mouth or the fingertips? Is the person gurgling, or even what they sound like it's snoring, which indicates maybe there's a partial obstruction respiratory depression that's occurring as a result of opioids. So, is the person breathing? And these are all questions that you should ask and would make you suspicious of opioid overdose. In that case, number one, call 911. Very, very important. Why? It helps in two ways. Number one, they will activate EMS, be able to get that ambulance over to you. So they'll be able to initiate that response. So time is very critical. So they get that process going. Secondly, even if you have training in opioid overdose, it's important that at the time you might be panicked, even though you learned everything, you studied, you're trained, and it's great to have 911 kind of walk you through in a slow and deliberate manner. So it's just kind of an extra line of support there. So what happens if they're not breathing? If they're not breathing, it's important to initiate CPR if you're comfortable with it. Of course, AHA does recommend training in this area. You may also want to include some rescue breaths in there as well. But again, it's based upon your comfort level and your ability to be able to do this. As well, if a lot of lay responders or bystanders don't have an AED, which is an automated external defibrillator. Not like we keep one of those in our homes ready to go. But if you do have one, for instance, that's when you might want to initiate. And then, of course, after CPR, because you don't know the person's condition as a lay person, just general public, you don't really know the situation that triggered this event, whether they had underlying cardiac disease. So CPR is extremely important. If you can do it, just if you don't want to do the breaths, then compressions are fine. And then administer naloxone, because you've seen that dirty needle, you've seen the empty prescription bottle, you suspect that there was an opioid overdose. Now, if you give naloxone and it wasn't an opioid overdose, there's no harm done. It will not have any deleterious or nasty effects if you do not take or ingest opioids. So there's really very little downside to giving naloxone and a huge upside. Again, most people find it easier to use the nasal spray. And as I mentioned before, you would use one spray in one nostril, wait 2 to 3 minutes, see if the patient responds. Meanwhile, you're still doing compression CPR. And then at that point, if you have to administer another spray, use the other nostril. And also keep in mind that the effects will last around 60 minutes. And hopefully by then, there would be medical personnel, paramedics, or that patient would be in the hospital setting. and would be able to take care of that person on the long term. So these are, some of the recommendations set forth by the AHA. And again, what's fantastic about it is it not only just addresses, healthcare professionals, but it also addresses everyone.